Welcome, Chloe. Thanks for joining me. So excited to have you on. I feel like everyone's going to get a lot from this episode and learning about you. So first, to start us off, just tell us a little bit about you and what a pelvic floor physio actually is.
So I'm Chloe, I'm a pelvic floor physio. I've been a physio for about 9 years now, and I specialised in pelvic floor about 4 or 5 years ago. And so with pelvic floor physio, we look at all types of physio related to the muscles that are underneath your pelvis. They help with your continence, so stopping you from leaking from your bladder or your bowel, and they help with your sexual function and also lots of different things related to your lower pelvis, including like pelvic pain and endometriosis and lots of different conditions like that. So we treat those conditions and try and improve people's quality of life.
Yeah, it's so important, and I feel like it's something that people aren't educated on. And I feel like when people think of the pelvic floor, they can automatically associate it with birth, pregnancy, and something you need to deal with when you're old. But I guess you could take us through how it's more, we should work on it earlier on as a preventative.
Yeah, definitely. And I think like a lot of women do, like for the first time, see a pelvic floor physio when they're pregnant, because a lot of people don't have or don't think they have any issues before they get pregnant. And then just because of the extra weight and pressure of pregnancy and all of our hormones making our ligaments really loose when we're pregnant, it puts a lot of extra strain on our pelvic floor. And that's when sometimes people get symptoms for the first time. But even then, people often don't think of it, and then they're left with symptoms after birth or when they come into later life, like menopause. And so all those hormonal changes and times in our life where hormones change is some of the biggest times where our pelvic floor might be put under strain or pressure. And if we had addressed some mild issues earlier, like before we got pregnant or before we went through menopause, then we might not have the same kind of symptoms. And sometimes when you get a diagnosis of prolapse, for an example, that's something that then you're probably going to have to manage forever. Whereas if you had prevented that, then you wouldn't have the same issue.
Yeah, definitely. So when would you suggest someone goes to see a pelvic floor physio?
Yeah, so anyone can benefit, even if you don't have any symptoms, especially like if you're planning to have kids, like if you're preparing for pregnancy or starting to try, that's a really good time to check in with someone just to optimise everything and learn how to contract and relax your pelvic floor, because it's really hard to learn that when you're pregnant because your sensation and everything changes so much. But especially if you've got any symptoms from your bladder or your bowels, even things like just needing to go to the toilet a lot or having to rush to the toilet and not being able to hold, like those things might seem mild and not really cause you any issues day to day, but then when you're pregnant or later in life can cause so many more problems. Same with constipation, something that you don't think is a real issue or like it's an issue for you, but it's not an issue to the point where it's causing you like physical pain or like prolapse or things like that. But down the track, that's definitely what can happen if you have untreated constipation and straining all the time.
It's such an interesting link, and I know particularly from my own experience, because I obviously haven't had babies.
Yes.
And I've definitely benefited from seeing for gut stuff, period pain stuff, all of that.
Yeah.
Can you tell us a bit more about particularly like the gut stuff and how, you know, what some signs might be that constipation, for example, might be more related to your pelvic floor than just having more fibre or your diet, things like that?
Yeah, definitely. So constipation definitely can be related to diet, but we can also get constipation that is because we're having trouble relaxing our pelvic floor. So it can be that if the stool is a good form, it's not too runny or it's not too hard, but you're then still having trouble emptying it. So you've got that consistency normal and, you know, you're going relatively regularly, but then you're still having to strain and push a lot to empty, or it's taking you more than like 5 minutes to empty your bowel. Or you're having to go like multiple times to try and finish, or you're getting any pain when you're trying to empty. All of that can be related to the pelvic floor and can be that when you're trying to empty your bowels, your pelvic floor is not relaxing properly as you do it.
Yes, and that feeling of not complete evacuation, I find that so common.
Yes.
Particularly in girls, and I guess with constipation in particular, there's so many different types of it. People just assume it's that sort of rapid poo consistency or not going to the bathroom for a week, but there's so many different subtypes of it and so many different supports. It's definitely like a very multifactorial condition, like a lot of things. Addressing all the areas is so important.
Yeah,
So,
definitely. And I think especially people with bowel issues and endo as well,
Yeah.
like there's such a connection there.
Totally.
And they often have difficulty in relaxing their pelvic floor because of the pain. And then that leads to the difficulty in emptying the bowels and not feeling fully empty. So it's a real cycle that all of the aspects of it affect.
yeah, I found that so fascinating when I learnt about that for the first time. The pain and the tensing of your pelvic floor from the pain, then leading to gut issues, for example, or potentially even like heightening the pain because your pelvic floor can be so tight.
Yes,
Like, I find that just incredible.
Yeah, and I think a lot of people don't even realise that their pelvic floor is switched on all the time because that's just been their normal for so long, like since maybe they first got their period even, or even since they were younger, if they did gymnastics or dancing or any horse riding sports like that really turn on your pelvic floor and use your pelvic floor a lot.
Those ballet lessons. Your pelvic floor.
And something that people just don't even realise that they're like on, and I might do an assessment and it'll be like, so at rest when you think you're relaxed, you're actually like 60-70% contracted. And they're like, what? It's so crazy that they don't even realise. And clenching your jaw, unless it's pointed out to you, you don't realise you're clenching it.
You get so used to it and you don't realise that's not normal when you're experiencing it every day. So, and I found that interesting too with the exercises and things like that. Like, it's just such a weird sensation because we're never taught about it, but it can make such a big difference to symptoms overall, like your gut and whatnot. But also, is there any links just with the endo stuff and painful periods, etc., because that's obviously a lot of what I see. Is there any link between pelvic floor dysfunction and worsened pain?
Definitely, yeah. So one of the biggest causes of pain, like a lot of the time people might have everything else from their endo managed, like they might have had a surgery, a scope to remove it. They might have seen a naturopath and their bladder and bowels and everything's going well now, and they've addressed inflammation, they've addressed a lot of other causes, but they're still getting pain. And especially like pain with sex and things like that as well that's related. It can all be actually because that pelvic floor has just become trained to be on all the time. And then that just causes that muscle spasm and tension, and then causes referred pain. And a lot of people don't even realise that, say, the pain that they might have actually in their lower abdomen or their pelvic, they might have in their lower back or their glute, can actually recreate that pain by pressing on a pelvic floor muscle. The pelvic floor muscle's away from where the pain is, but then the pain is reproduced by that muscle, and that shows us that it's actually that muscle that's causing that pain rather than maybe you thinking it's actually an organ or the endo around an organ. Maybe it's not that. Maybe it's actually referred from that pelvic floor muscle. Yeah,
it's so crazy. And girls, if you haven't had your pelvic floor assessed, to experience that sensation, it's crazy. Particularly as well, do you find a lot of gym goers have issues with their pelvic floor?
Definitely, yeah. And I think like a lot of people too associate it with they might leak when they play netball, or they might leak at the gym or things like that, and they think, oh, my pelvic floor must be really weak. But a lot of the time it might not be weak, it's just that we can't actually relax it so that it's getting so fatigued because it's on so much that we don't have that ability to stop a leak because it's so high. Like we can't contract it anymore when more pressure comes down because it's already so contracted.
Crazy. So obviously you work with a lot of pregnant women. Tell us about the pelvic floor in pregnancy and why it's so important to look after it and make sure you're putting effort into that area, because I feel like it's, but as we mentioned earlier, it's very much like putting out spot fires later down the track rather than preventative work. Tell us a bit about working with pregnant women and what you do.
Yeah, so in pregnancy, as I said at the start, there's so many changes that happen to our pelvic floor, and a lot of the time we might not actually develop any symptoms when we're pregnant, but it might be after birth that we start to get symptoms and then realise that actually doing some work while we were pregnant would have hopefully prevented a lot of those symptoms. Doing pelvic floor exercises when you're pregnant can also really significantly reduce your risk of tears. So, you can have less severe tears and better healing and recovery, less pain, less leaking, all of that kind of stuff just from doing pelvic floor exercises while you're pregnant. And I think a lot of people are trying to do pelvic floor exercises, but they may or may not be doing them actually correctly if they haven't had an assessment. And they might be, as we talked about before, having difficulty in relaxing. So then more strengthening is not what they need. They need that relaxation first before they can actually start to strengthen. And the different people that I see in pregnancy, every case is different and everyone needs like a different individualized set of exercises. So I think that's where it's really important to get that assessment.
Yeah, definitely. And what does pelvic floor care actually look like? Because I imagine and I know it's obviously more than just doing your Kegels.
Yeah, definitely.
Tell us a bit about things that you do, particularly in pregnancy.
So I think like always addressing like any of those things that could be causing more strain on the pelvic floor. So looking at constipation and looking at how you're going to the toilet, even using a toilet stool and getting in a better position to reduce that strain and pressure on your pelvic floor when you go. And I think like one of the biggest things that I see that actually causes prolapse in women who are early after birth is actually constipation and straining. And a lot of the time, if they hadn't been constipated and they'd been able to manage that a bit better and they hadn't strained and put pressure on their pelvic floor, they might not have ended up with a prolapse. So it's something that can then lead to lifelong management of needing that always to be looked after. Not to say that prolapse can't improve or get better in that early period after birth. A lot of people then will have to constantly manage those issues, and it's something that if we could prevent it makes such a big difference to people's lives. And something that people don't even think about a lot of the time when they're pregnant. They think that prolapse is something that happens to people when they're old, but a lot of the time 50% of women who've given birth vaginally will get some level of prolapse. So that's where it's just so common, and that prevention is so important.
Definitely.
And then we do pelvic floor exercises, and not just Kegels. It's not just like turning on and off, which a lot of people think it is. And I guess a lot of people are following people on TikTok and doing those squeeze alongs and all of that kind of stuff, which is great, but it also may or may not be what you need to do for your pelvic floor. So that's where it can be a bit tricky, and like it can be great for a little bit of a reminder to do your exercises and be like, oh yeah, I haven't done them today, and go through and do what you need to do. But just following those random programs a lot of the time won't make a massive difference, because it's not going to be specifically building up enough fatigue or enough sets and reps and things to actually strengthen the muscle.
Like anything, it's so individualized.
Definitely, And the other thing that we look at is preparing for birth. So trying to reduce our risk of tears by doing things like perineal massage. Teach women how to do that, and that can really reduce their risk of tears. So something that, again, a lot of people might not know about, but it can actually reduce your risk of a severe tear by 50%. So it's really significant in that improvement. And something that might be mentioned by your midwife or your obstetrician, but something that if you don't actually know how to do it, a lot of the time people aren't doing enough stretch or like actually getting that proper lengthening of the pelvic floor when they're doing it to make it effective. So that's where learning how to do it properly can be really helpful.
Yes, and like education. With both of our jobs, education is such a big component of it. So definitely, that's so interesting. So tell us about your course.
So my course is all about really preparing your pelvic floor for pregnancy and for birth. So it's got a lot of different education that we've talked through. So it goes through what you can do in pregnancy with your pelvic floor exercises, and it goes through how to assess yourself so that you can be a bit more sure that you are contracting correctly, especially if you don't have access to seeing a physio face to face. And also we go through like lots of different things to help manage different issues in pregnancy, like pelvic girdle pain, and how to help manage and reduce any of the like rib pain and different things that you can get during pregnancy. And then we've got a whole module just on looking at like pain relief during labour and what natural pain relief techniques that we can use to try and help. And then we also look at like the interventions that can happen during birth, and then how these might affect your pelvic floor and how the choices that you make during birth. We can sometimes birth is unpredictable and out of control, but we can then know, okay, we've had this intervention which increases our risk of this, therefore we need to do this to help mitigate that and reduce any effects of it and things like that. And I think being fully informed and knowing what all of these interventions can do can really help to reduce like birth trauma and things like that, because it's one of those things where a lot of women that I see, like especially second-time mums, they just say, I just wish someone had told me that having a forceps delivery might increase the risk to my pelvic floor, so then I didn't go and do really long walks and lift heavy things and end up with a prolapse. Whereas, and some people can go and get straight back into exercise, lift heavy things and not be at risk. But then there's people that have had different deliveries that are at risk and need to be a bit more careful. So that's where that individualised, depending on what's happened during your birth, can make a big difference to your recovery.
Definitely. The common thread I find is just everything is so individual, and also prevention and education is key. So
definitely. And I think so many people just really regret not having addressed it before birth, because then, as I said, if you're then developing leaking or you're developing issues down the track that are so much harder to manage than they would have been to actually prevent.
For sure. Where can people find you?
So you can find me at the Lady Physio on Instagram and TikTok, and I've got a website with my course, so you can have a look there. I've got a little free download with just how to do your pelvic floor exercises in pregnancy in a little bit more detail, so looking at the different types of exercises and things that we need to focus on. So you can definitely pop that in your toolbox of things to do during pregnancy and have a look at my course and go from there.
Great. I'll link everything below, but otherwise, thanks so much for joining me.
No problem.
My first guest.
Yes, thank you so much for having me.